talking, I'm hearing trauma. I'm hearing the emotional aspect of it. Does any of your work tie into how past trauma has impacted what's happening in their body?
Well, first of all, I make sure they get to someone like you. Okay, first, I stay in my lane. I stay in my lane. Okay.
I heard that team, but I didn't hear my name in it. I was like, hey, I have talked to Dr. Krause about this.
I've been really fortunate to be practicing in Maryland since 1997. Okay. During that time, I've developed many relationships, and really, in relationship with the patient and the doctor is the most important.
Yes.
And if I can't connect empathically or like have empathy for the person that's directly across from me, and I'm not looking at that clock where so much of our healthcare is now, okay, I got 10 minutes and I'm staring at the EMR trying to get my notes done
right.
to make my bosses happy, to keep insurance happy, to all this stuff. If I can put that stuff aside and actually sit across from someone and connect with them and understand what their needs are, their desires, their fears, their traumas that may have been involved physically and emotionally, because pain can be elicited through emotional trauma too,
right.
as you know. So if someone has that going on and it's never been cared for, addressed, or whatever, you might be starting down a pathway where that's not what they need. They don't need as much physical care. They haven't taken care of the emotional component. So absolutely, it can be a significant, especially with the chronic pain syndromes that we see.
Yes.
People in their 30s, 40s, 50s.
Yeah.
And there's so much we don't know about conditions like fibromyalgia and those kind of things where the emotional component turns on something biochemically in our body, and then we're no longer functioning normally. So now, talking about working with a therapist, talking with a neurologist, maybe even a rheumatologist. Certainly, my first stop is always primary. Like, I want to make sure that they have a great relationship. Shout out to Dr. Wasim Hussein, MD in Greenbelt, Maryland. He's mine, okay? I'm a chiropractor. If you have an M and a D after your last name, I'm a little trepidatious of you until I get to know you. I'm sorry, but that's just the way it is for me. So I don't just refer to any MD. So mine, he's on my team. He's got my back. But I also, I know great neurologists. I know great physiatrists, anesthesiologists that do pain management, that do the epidurals, facet blocks, nerve block, all that kind of, there's an entire profession in between chiropractic physical therapy and surgery that most people don't know anything about. It's called pain management. And that's not synonymous with opiates, because we don't want people on that. There are a bunch of interventions. There's an entire pain management profession that most people don't know about because they either go to the ortho or they go to the neurosurgeon, and they skip. They go from us to that, and they don't go. And so it's my job to make sure they end up at good practitioners, and that they don't jump the gun and do something really invasive too soon.
So how do you, for some of your patients that may want to take a holistic approach towards, managing their chronic pain, how do you deal with, or how do you advise your patients with taking that holistic approach?
Well, I wish I had the time to sit there and go through the nutrition and stuff like that. Okay, that's not my passion. Although I personally it is. Okay, but it's not professionally my passion. So they need to take a close look at what they're doing day to day. How are they living their lives? Are they sleeping properly? Are they putting in? Do they have proper nutrition? Right? And if they're doing all that stuff wrong and eating all this stuff that's causing inflammation in their body, it's not going to take a whole lot of repetitive stresses and asymmetrical postures that are going to contribute to a lot of these pain syndromes. Not to mention the degenerative stuff as a result of the wear and tear of the sports and the motor vehicle collisions and that kind of stuff over time.
Exactly.
Now it's just the iPhone or iPad or even a desk.
Yeah.
Or just molding to this environment over time.
Absolutely. Wow. So, Dr. Krause, can you just share just a little bit about, because we spoke about scare care and how you will not be a participant of that. Talk to us a little bit about that.
Well, my experience has been, as chiropractors, we're kind of thrown to the wolves. All right, I don't have a hospital referring to me. When I go into practice, I'm starting on my own. I'm hanging out my shingle, and I don't have any connections. I don't have people feeding me patients. So we have to go into the community. And I was never trained for that. I was trained as a chiropractor. I'm pretty good at that. But as far as building a clinic and getting out there and educating the patients, I have to go out and create that. So that's real work, and it's scary, and it's hard. It's difficult. And so I find that a lot of my colleagues will take any kind of patient anyway because they're in business. They're desperate to, and maybe holding on to them a little bit longer than they should. Scare care to me, what that means is, for me, it would be putting up x-rays, going over the x-ray analysis and pressuring them to buy my care, because if they don't, they're going to have all sorts of problems later. That may be true, but you can't call me, if you call me a used car salesman, I'm a doctor. First and foremost, I want you to take this care. I know you're going to be better, but I can't manage your 3 jobs. I can't manage your 2 kids. I can't, you know what I mean?
Right.
Like, caring about the patient means caring about the whole patient,
Right.
not just going after the clothes. And to me, scare care is saying, oh my God, this person really, they're looking at serious disability later in life, and maybe some really bad pain and herniated discs and these kind of things within the next few years. How do I deliver that message to them without it making it be like I'm just trying to get them signed on the dotted line? And as a healthcare provider and a business owner, this is like a push and a pull. That's a real thing for providers. And so, yes, I want as many people as possible to take my care. Yes, I know I can help them directly or indirectly.
Right.
No, I don't want them to go and take a second mortgage.
Right.
You know,
Absolutely.
Caring about patients means caring about their finances. And I was talking with one of your next guests, and it sounds like you got some good people here that are going to be educating us on that too.
Absolutely.
We all need it.
Absolutely. So I tell you, can you share all of your contact information, more information about the new clinic that's coming, and how people can keep abreast of what's going on with that?
Thank you so much for that. My name is Dr. Daniel Kraus. I was born in D.C., raised in Silver Spring. So I got to say, shout out to the class of '88, John F. Kennedy Cavaliers in Glenmont, right? And University of Maryland, 1992, class of 92. Terrapin Care Center started in 2001. We are an integrated pain management clinic. TerrapinCareCenter.com. Dr. Levi Riley is the director there. Dr. Rachel Ween is our other chiro. Dr. Malik is our DPT. Allison, our acupuncturist, and Idamar Simone, our nurse practitioner, are amazing at keeping people off drugs and away from surgery whenever possible.
Awesome.
We have a great network of MDs, surgeons, PTs. We've got a great team that we refer to. My other clinic, which I'm about to launch any minute as soon as Montgomery County lets me, is called Bethesda Spine and Posture.
Nice.
And if you spell it out, BethesdaSpineandPosture.com is the email address. And I'm hoping to be open here in the next week or so.
Wow.
With a focus on chiropractic biophysics, postural correction, and Scoli care bracing, which is a 3D amazing Scoli brace for degenerative scoliosis, but also for juvenile and adolescents. I'll be doing that too. And that's really my focus.
Okay.
If people are in pain, I'm going to get you to where you need to be, either with me or with someone else. But we're going to help you any way we can.
I love it. Dr. Daniel Cross, I'm
you
so
so much.
excited,
It's a pleasure.
and I can't wait till your new clinic is open. I feel the passion for your work.